If you or someone you know has been diagnosed with severe asthma, you may be wondering what options are available beyond traditional medications such as inhalers and corticosteroids. In recent years, a new class of medications called biologics has emerged as a promising treatment option for people with severe asthma. Biologics are a type of medication that targets specific molecules or cells involved in the immune system's response to asthma. They can help reduce asthma symptoms, exacerbations, and the need for oral corticosteroids. However, as with any medication, biologics have their own set of benefits and potential risks. In this video, we'll provide you with 10 helpful pieces of information about the use of biologics in the treatment of severe asthma. Whether you're a patient or a caregiver, we hope this information will be useful in helping you make informed decisions about managing severe asthma. 1. Biologics are designed to target specific molecules or cells in the body that are involved in the immune response to asthma. For example, some biologics target interleukins, which are proteins that play a role in inflammation. Others target IgE, an antibody that can trigger allergic reactions, or eosinophils, a type of white blood cell that can cause inflammation in the airways. By targeting these specific molecules or cells, biologics can help reduce inflammation and improve asthma symptoms. 2. Biologics are typically administered through injection or infusion in a clinical setting, rather than as an inhaler. This is because biologics are large molecules that cannot be absorbed through the lungs like inhaled medications. Instead, they need to be delivered directly into the bloodstream through injection or infusion. Typically, biologics are administered by a healthcare provider in a doctor's office or hospital setting. The frequency of administration and the dosage of the biologic will depend on the specific medication being used and the individual patient's needs. 3. Biologics have been shown to be effective for people with severe asthma that is not well controlled by standard asthma medications, such as inhaled corticosteroids and long-acting beta agonists. Severe asthma is defined as asthma that requires high-dose inhaled corticosteroids plus a second controller medication, such as a long-acting beta agonist, to achieve control, or asthma that remains uncontrolled despite this treatment. Biologics are typically used as an add-on treatment for people with severe asthma who continue to experience symptoms despite taking standard medications. Biologics have been shown to reduce asthma exacerbations, improve lung function, and reduce the need for oral corticosteroids in people with severe asthma. 4. Biologics have been shown to help reduce asthma symptoms, asthma exacerbations, and the need for oral corticosteroids, which can have significant side effects when used long-term. Corticosteroids can cause a wide range of side effects, including weight gain, high blood pressure, diabetes, osteoporosis, and an increased risk of infection. By reducing the need for oral corticosteroids, biologics can help reduce the risk of these side effects. In addition, biologics can help improve quality of life for people with severe asthma by reducing the frequency and severity of asthma symptoms and exacerbations. However, as with any medication, biologics have their own set of benefits and potential risks, and it's important to work closely with a healthcare provider to determine if biologics are a suitable treatment option for your individual needs. 5. There are several different types of biologics that have been approved for the treatment of severe asthma. These include Omalizumab. This biologic targets IgE, which can trigger allergic reactions. Omalizumab is approved for use in people with moderate to severe allergic asthma. Mepolizumab. This biologic targets interleukin-5, IL-5, which is involved in the production of eosinophils, a type of white blood cell that can cause inflammation in the airways. Mepolizumab is approved for use in people with severe eosinophilic asthma. Reslizumab. Like Mepolizumab, Reslizumab targets IL-5. Reslizumab is approved for use in people with severe eosinophilic asthma. Benralizumab. This biologic targets the IL-5 receptor, which is involved in the production of eosinophils. Benralizumab is approved for use in people with severe eosinophilic asthma. Dupilumab. This biologic targets interleukin-4, IL-4, and interleukin-13, IL-13, which are involved in inflammation and airway hyperresponsiveness. Dupilumab is approved for use in people with moderate to severe asthma with type 2 inflammation. It's important to note that not all biologics are suitable for all types of severe asthma, and the choice of biologic will depend on the individual patient's needs and medical history. Your healthcare provider can help determine which biologic is the most appropriate for you. 6. Biologics are usually prescribed based on a patient's specific type of asthma and the biomarkers present in their blood or airways. Biomarkers are specific proteins or other substances in the body that can indicate the presence or severity of a disease. In the case of asthma, biomarkers can help determine the underlying cause of the asthma and which type of biologic may be most effective. For example, the presence of high levels of eosinophils in the blood or airways may indicate the presence of eosinophilic asthma, which may respond well to biologics that target IL-5 or its receptor. In contrast, high levels of IgE in the blood may indicate the presence of allergic asthma, which may respond well to biologics that target IgE. Your healthcare provider will typically conduct blood tests or other diagnostic tests to determine your specific asthma type and biomarker status. Based on this information, they can help determine if a biologic is a suitable treatment option for you, and if so, which specific biologic may be most effective. It's important to work closely with your healthcare provider to determine the best treatment plan for your individual needs. 7. While biologics are generally safe and effective, like any medication, they can have potential side effects. Some of the common side effects of biologics include injection site reactions, such as redness, swelling, or itching at the injection site, and allergic reactions, such as hives, difficulty breathing, or swelling of the face, lips, tongue, or throat. Rarely, biologics can cause more serious allergic reactions or anaphylaxis. In addition, because biologics target specific cells or molecules in the immune system, they can increase the risk of infections. This can include infections such as upper respiratory tract infections, sinusitis, or urinary tract infections. People who take biologics may also be at increased risk of developing certain types of cancer, although the overall risk is still considered to be low. It's important to work closely with your healthcare provider to monitor for any potential side effects and to follow their recommendations for managing any symptoms or concerns. In some cases, it may be necessary to adjust the dose or frequency of the biologic, or to switch to a different medication if side effects are severe or persistent. However, in many cases, the benefits of biologic therapy may outweigh the potential risks, particularly for people with severe asthma that is not well controlled with other treatments. 8. Biologic medications can be expensive, and the cost may be a barrier for some people to access these treatments. The cost of biologics can vary depending on several factors, including the specific medication, the dosing schedule, and the duration of treatment. In addition, because biologics are relatively new medications, they may not be covered by all insurance plans. However, many insurance companies now cover some biologics for the treatment of severe asthma, particularly if other treatments have been ineffective or if there is a significant risk of exacerbations or hospitalization. If cost is a concern, it's important to talk to your healthcare provider and your insurance company about your options. Your healthcare provider may be able to work with your insurance company to obtain coverage for a biologic, or they may be able to suggest alternative treatments that are covered by your insurance plan. In some cases, the manufacturer of the biologic may also offer patient assistance programs to help offset the cost of the medication. Overall, while cost can be a barrier to accessing biologics for some people, it's important to discuss all of your treatment options with your healthcare provider and to work together to develop a treatment plan that is effective, safe, and affordable. 9. Biologics are not a cure for asthma, and their effects may wear off over time. While biologics can be effective in reducing asthma symptoms and the frequency of exacerbations, they do not eliminate asthma completely. In addition, some people may develop resistance to biologics over time, which can reduce their effectiveness. This is why it's important to work closely with your healthcare provider to monitor your asthma symptoms and to adjust your treatment plan as needed. If you are prescribed a biologic for the treatment of severe asthma, it's important to follow your treatment plan as directed by your healthcare provider. This may include regular monitoring of your asthma symptoms, as well as periodic testing to evaluate the effectiveness of the biologic and to monitor for any potential side effects. Overall, while biologics can be an effective treatment option for some people with severe asthma, it's important to keep in mind that they are not a cure and that their effects may wear off over time. By working closely with your healthcare provider and following your treatment plan, you can help ensure that you are receiving the best possible care for your asthma. 10. Biologics are typically prescribed by specialists such as allergists or pulmonologists who have experience in treating severe asthma. These healthcare providers will evaluate a patient's asthma symptoms and biomarkers to determine if a biologic treatment is appropriate and which specific biologic medication to prescribe. Once a patient begins biologic treatment, they should be closely monitored by their healthcare provider for both efficacy and side effects. This may include regular testing to evaluate the effectiveness of the biologic in controlling asthma symptoms, as well as monitoring for any potential side effects, such as allergic reactions or an increased risk of infection. In addition, patients receiving biologics may need to make frequent visits to their healthcare provider to receive injections or infusions of the medication, which can be administered in a clinical setting. By working closely with a specialist and following their treatment plan, patients receiving biologics can help ensure that they are receiving the best possible care for their severe asthma and that any potential side effects are identified and addressed promptly. In conclusion, biologics have shown great promise as a treatment option for people with severe asthma. If you have been diagnosed with severe asthma and are struggling to manage your symptoms with traditional medications, it may be worth talking to your healthcare provider about whether biologics could be a good option for you. However, it's important to keep in mind that biologics are not a cure for asthma and may not be suitable for everyone. As always, it's important to work closely with your healthcare provider to determine the best course of treatment for your individual needs. Thank you for watching, and we hope you found this video informative and helpful.